Now, for the latest on variants and vaccinations when it comes to COVID-19, let's check in with infectious disease specialist Dr. Zain Chagla. Good morning.
Hi, good morning, Annette.
So you were on a panel this week that talked about the end of the pandemic, whether it was going to end quickly or just kind of whimper and we're going to deal with this for a very long time. What's your take on that?
Yeah, I mean, there's a lot of parts of this virus that mean it's not going to be eradicated from the earth, right? There are people that are asymptomatic and pre-symptomatic that spread the virus around, so we can't necessarily test everyone. The vaccines work really well, but there are breakthrough cases, and we're still not clear about what's going on with animals and whether or not it goes into those species as well. And so, those are the typical features of a disease that could be eliminated if it's easily to diagnose, if you have an intervention that works almost 100% of the time, and it doesn't go into the animal species. So there's lots of things against this. What I think the end of COVID locally will look like is healthcare capacity reducing to a point where this is a manageable disease, where most people have a very outpatient outcome. They never make it to hospital. Our ICUs don't fill up. But, I think there's something to be said. That's what Canada's endpoint looks like. The global endpoint really is going to be a long time, and vaccine equity is a big part of that. And with variants circulating, there's a selfish reason even to think that our role in the rest of the world is going to play a role in terms of how the pandemic ends locally as well.
Right, because the head of the WHO has been calling out other countries saying, a number of countries really hold the fate of the rest of the world in their hands with how we're dealing. So here we are, we're pretty, we're feeling good that, okay, our vaccination rates are up, we're vaccinating children yet. But then you look at, there are healthcare professionals in other parts of the world that haven't been vaccinated at all.
Yeah, absolutely. And again, what's going on in India right now is concerning. There are 5 to 10 other countries with the instability and the right population to have exactly what happened in India happen to them in Nigeria and Pakistan and Malaysia and in Indonesia and Philippines. All it takes is some of these which are starting to circulate. And, it's do we want to be the people that watch this happen in real time when there's an intervention to help prevent it? Or are we, as global citizens going to help prevent that from spreading? And, those countries are huge melting pots that are, the right product for development of new variants. And, whatever happens there is going to affect us globally as well. So we even have a selfish interest to keep things under control there.
Well, you think of how many vaccines India produces as well, right? And the variants are affecting that because they don't have enough lab workers.
Yeah, exactly, right. And the Serum Institute of India was supposed to actually fund much of COVAX, the global network for vaccine distribution that was set up by the World Health Organization. Well, they're not able to make their capacity because they're too busy trying to vaccinate their own population with this. So, again, global vaccinations have fallen short. There is, some supplementation by vaccines outside of the North American experience, like the ones produced in China and Russia. But again, this is going to lead to a lot of problems. It's going to lead to a lot of deaths that are needless for the sake of, again, this nationalism for vaccine campaigns.
Right. Is the variant that was first discovered in India, is it in Canada now?
Yeah, I mean, I think we're seeing cases, the vast majority seem to be travel related, although we haven't seen a lot of disclosed data around things. I think it's probably safe to assume that it's going to start circulating in Canada. I mean, we're seeing what's happening in England in real time, in Bolton and other places where this has established itself. It's rapidly taken over B.1.1.7, the variant first described in the UK. So, if this starts circulating here, which I can't imagine it hasn't, given that, we've had a lot of introductions through travel, I think we'll probably see this starting to circulate here more and more over the coming weeks and months.
Okay. Dr. Zain Chagla, infectious disease specialist, thanks very much for joining us again.
No problem. All the best.
Okay, you too.